Good afternoon, everyone, and welcome to another edition of Ask Max Expert live session. Today we have Dr. Sashank Chaudhary, Principal Consultant, Surgical Oncology, Cancer Care, Robotic Surgery at Max Super Speciality Hospital, Lucknow. Dr. Sashank specializes in surgical oncology, cancer care, laparoscopic surgery, head and neck oncology, thoracic oncology, and more. Today, he will share expert insights on tobacco consumption and rising oral cancer risk. So, doctor, over to you.
Hello everyone, myself Dr. Shashank Chaudhary and I am a Principal Consultant Surgical Oncologist in Max Healthcare Lucknow. And I am dealing with all type of cancers like most commonly head and neck cancers, breast cancer, thoracic cancer, GI cancer and gynecological malignancies and bone and soft tissue tumors. So cancer is growing day by day and it is increasing 25 to 30% per year. This data is increasing, so we should be more and more into how to aware the patients about the cancer, how to aware the ill effect of smoking and tobacco. So that's why 31st of May WHO has organized and we are celebrating 31st of May as a World No Tobacco Day to study to aware the people, patients and the people about the harmful effect about smoking and any types of tobacco we are chewing.
Thank you, doctor. So, we have a couple of questions coming in front of the audience. The first question is, doctor, many people think smoking only affects the lungs. How strongly is tobacco linked to oral cancer specifically?
So, very important question that is smoking only affect the lungs, but smoking have a lot of ingredients like coal, tar, and many of micro heavy metals. They have which are burns, and they are affecting all of the whole of the body like lungs, heart, kidney, liver. Even in the microscopic in at to cellular level, they are affecting each and every cells of the body. But the most commonly it is affecting lung because it is inhaled through the mouth. So most commonly exposure is the lung, and the most common ill effect of smoking is basically lungs.
Is chewing tobacco more dangerous for oral cancer than smoking cigarettes?
Smoking, cigarette, and tobacco are both are equally responsible for any type of cancer. Oral cancer most commonly caused by tobacco chewing and smoking. Tobacco chewing because it is a local, it causes local inflammation over the oral buccal mucosa. So it causes chronic inflammation in the oral cavity because we are not inhaling or we are not chewing inside the tobacco. And smoking is causing chronic inflammation through all the airway tracts from starting from the oral, pharynx, esophagus and stomach. So smoking affect all of the upper airway and lower tract, and the tobacco, since we are using locally, so it is more into the oral cancers and pharyngeal cancers.
Thank you, doctor. The next question is, what are the early warning signs of oral cancer that people usually ignore?
So the most common signs of oral cancer is that a patient who is having tobacco, they develop an ulcer that is a chronic and non-healing since weeks or month, and associated with the induration, associated with the hardness over the ulcer. So any patient having ulcer that is non-healing and hardness should be checked, should be biopsied, and should have further investigation to rule out whether it is malignancy or not. And second, the most common we see that patient is having a bad odor or having ulcer over the tongue or having hemoptysis or bleeding from the mouth, then they should have a regular checkups to the doctor, dental or ENT, or in case oncologist, for confirmation whether they have a cancer or not.
Another question we have is, can occasional tobacco use also increase oral cancer risk, or is it mainly long-term users?
So this is very important question because first of all we should see that a patient who is taking tobacco for since year and haven't stopped, and a patient who has taken tobacco and he has stopped. So the risk of having oral cancer is more to the chronic tobacco chewer and who is taking tobacco at present also. But those who have taken the tobacco and they have left, they are also having risk, but less risk because their exposure is less. So they have risk, but we can't say that they are not into the risk, but they have risk for developing oral cancer in these patients also. So any type of tobacco chewing at any point of time increases the risk of developing oral cancers. The second most common is that I will want to add to this that oral cancers associated with tobacco, but a lot of patients we are seeing they are not into tobacco chewing, but they are having oral any type of oral cancers. The reason is that tooth bite or poor dental or poor hygiene or HPV infections. These are also a predisposing factor for developing oral cancers.
Thank you so much, doctor. Moving on to the next question. Are younger people also at risk of oral cancer today because of gutka, vaping, or flavored tobacco products?
So this year WHO is basically the theme is that to protect the young children and young adults from having exposure to the tobacco in any form, whether it is smoking or vaping or any type of gutka, masala, khani. Because younger they are more into they see advertisements which are coming in our TV with a lot of big stars, they are advertising these products. So the young generations they are more fascinating about that we should take smoking or having because in youngs we are if we अगर हमारे youngs जो है they are not very good at health, then how can we think about our future? So young children are very much at risk because of increasing social media activities. So they are more into fashionable traits that we should go for smoking or vapings and all these things.
And some people say switching from cigarettes to vaping is safer. Like, does vaping also affect oral health and cancer risk?
See, smoking is burning us leaves. है ना? Leaves is burning, and what about vaping is it is an aerosol. We are burning the water. Though the vaping don't contain any carbon monoxide or something that materials present in the smoking, but though vaping is also having heavy metals and there are also their dangerous projects, we can cause ill effect over lungs, and chronic lung injuries can be developed due to vaping. So a patient is a person is a smoker, then he can switch to the vaping for early मतलब उसको अगर smoking छोड़नी है, then we can go for a vaping. But if a patient if a person who hasn't smoking and starting vaping, this is not allowed. So vaping is also high risk for our health. So there is no better, whether it is not good to say that we should go for a vaping in comparison to smoking.
Thank you, doctor. Another question we have, which areas inside the mouth are most commonly affected by tobacco related oral cancer?
The most common affected area is cheek, because the most common area where the mostly tobacco users or in form of tamaku or masala, they used to keep that tobacco inside that area over this sulcus. There is a sulcus between the teeth and the cheek, so they keep that area and this become chronic inflamed. So this is the most common. Second most common is tongue, and third after third that lip and hard palate and soft palate, they are coming.
Is oral cancer curable if detected early? What difference does early diagnosis make?
The most important for oral cancer is a totally curable disease. First of all, the patient should be aware that early detection will lead to only surgery, will cure 100% in all these patients. And if the stages increases, like from buccal mucosa, if it is involving the muscles or bone, then or nodes, because oral cancer develop and go into the nodes. The nodes are also involving that it becomes stage 3 or stage 4. So as early as possible, we start the treatment of oral cancer like surgery, then radiation or chemotherapy depending upon the stage of the patient, then we can cure the disease very much likely. But if the stage 3 and stage 4, then patient will undergo surgery and radiation and chemo, but the chances of survival will decrease. So early stage survival is more than 95%. For stage 2, it is about 80 to 90%. For stage 3, it is less than 70%. And for stage 4, it is more less than 40 to 50% survival.
Thank you, doctor. We have another question. What symptoms should make someone immediately visit a doctor or dentist for screening?
So I have previously told you that any type of ulcer over buccal mucosa, over cheek, over tongue, over palate, that is visible to you, and you have taken medications like antibiotic or painkillers, but it is not resolving for weeks and for month, and with it is also slowly growing, with having a base. That base of the ulcer is hard, so you must visit a dental doctor or ENT or an oncologist for confirmation whether it is a cancer or just a normal thing.
And are regular dental checkups helpful in detecting oral cancer early?
Yes, because oral cancer is directly linked to the poor health hygiene. So very important, we should regular visits our dental checkup for the oral cancer detection. If in case because of sharp dentures we develop an ulcer over tongue or over the cheek, that may lead to become a cancer. So a proper checkup of oral, whether our tooth are good or not, whether they are having any infection or not, these all may lead to cancer. So we should have a regular dental checkups.
Okay, thank you, doctor. Another question we have is can oral cancer develop even if a person has quit tobacco after many years of use?
After many years of use tobacco, because tobacco causes field cancerization. Tobacco affect all of the cells of the buccal mucosa and oral mucosa. So what happened? They causes fibrosis over the mucosa. So after the fibrosis, if the patient have stopped the tobacco chewing, then the fibrosis may relieve slowly. It may relieve fibrosis, but we have seen the patient that they have stopped the tobacco chewing for years and months. So the tobacco related cancer may decreases incidence in these patients, but just because of reduced mouth opening of previous having a lot of tobacco, the patient may develop ulcer because of tooth biting. So we can have a regular checkups yearly who have not taken tobacco but they have developing ulcers. So they must visit the dental or a ENT doctors to see whether they are having any ulcer that is not healing. So risk always will be there, but though it is decreased risk, but they will have a risk for developing cancers.
Thank you, Dr. Shashank. Moving on to the next question. Does alcohol consumption along with tobacco further increase the risk of oral cancer?
Yes, alcohol has and smoking, and in any form of smoking like tobacco increases the risk of oral cancer, but alcohol is not directly linked to developing of the oral cancer. So it is both are addictive. They may cause a lot of detrimental effects and cancer causing effect over all of the whole of the body. But for oral cancer, alcohol is not a directly connected to the cancers, oral cancer.
Moving on to the next question. What lifestyle changes can help reduce the risk of oral cancer besides quitting tobacco?
Besides quitting tobacco, the most important for oral hygiene is that we should brush our teeth in the morning and the evening. We should regular visits to a dental doctor yearly, at least yearly. We should have a. If we are developing any oral infection or any type of ulcer, we should go for a treatment accordingly. And if having a patient developing white patches or red patches over the buccal mucosa, because these are called leukoplakia and erythroplakia, so the patient must, if they have disease, if they have any type of lesion over the buccal mucosa, they should visit the doctor to see whether it is a disease or not, because a doctor will diagnose that the patient is having cancer or not, because it is not you will diagnose. Do not google everything. Otherwise, we cannot diagnose the patient as early as possible.
Thank you so much, doctor. There is another question we have. For someone trying to quit tobacco, what is the first practical step you usually recommend as a doctor?
The most important thing for tobacco cessation is that smoking cessation is that the patient willpower should be very strong, because sometimes patient they stop tobacco chewing for 10 days or 2 weeks or 3 weeks, then they start again. So the willpower is very important. You can switch on from having a nicotine like of chewing gums are there, and they may switch off to some other products like they have a ilachi or small long types, so that they have craving. They can reduce the craving for tobacco chewing, and the most important thing is that willpower. So without willpower, we cannot stop the cessation of smoking.
Thank you very much, doctor. Dr. Stang, for your valuable insights and precious time, please share a concluding message that you would want to pass on to our audience.
So the most in today in a day-to-day life, we see a lot of cancer patients, and the most common, every patient is thinking that why we are into this disease, why the cancer is to us. We have not done anything. Sometimes patient is not smoking or not tobacco chewing. The most important thing is that you should be aware about your body. The most important thing is that you should know that what are the new symptoms, what are the problems you are having in your body chronically. Sometimes patient is having an ulcer in the oral, sometimes patient is having the lump in the breast, sometimes patient is having bloating that is chronic, sometimes they are having bleeding from the rectum, or red color stools or black color stools for chronic. Anything in your body that is not a new, that is has been chronic for months, either weight loss or your loss of appetite for for many months, so you must visit to your doctor. Don't think that you will not develop this disease, because a lot of 90% of the cancers are developing, they don't have any reasons. 90% patients, they have environmental related factors which are causing the disease. So what we are eating, what we are doing in our day-to-day life, you should have a check on your body. So the most important thing the cancer we can treat is that we should aware the people about what are the high risk for developing cancers. So the most important thing is that do physical activities, any type of physical activities in a day, or reduce your obesity, less what you are eating. Don't go for a lot of street foods, and apart from that, any type of symptoms you are developing, you must have a check and go to the doctor and rule out that you are not having malignancy, because early detection will save the life. And this, in any case, if we are detected in the late stages, no treatment is going to very much effective in all these things. So the early detection will save the life is the main motto of our cancer awareness.
Thank you, doctor. Thank you, audience. Wrapping up the live session here.